So hi everyone, I'm glad to see everyone. My name is Monica DePriest, and as you can see, this is me, my daughter Haley, just a couple of years ago from her high school graduation. The reason why we're here today is at age 7, my daughter was involved in a skiing accident, which resulted in the fracture breaking of her tibia plateau, and which resulted in 2 surgeries in her left leg, where one surgery was inserted into her tibia. The next surgery resulted in the removal of the screw from her tibia. And there was a 6 months time lapse between the two. During the next 3 years, at age 10, approximately age 10, between ages 7 to 10, Haley had numerous different increments of pain, and we went back to the doctor 3 and 4 different times. The surgeon assured us that the pain was a result of the surgery, but it was just from the screw itself having been put in and removed. And that was fine. We took some ibuprofen, probably of the 10 times that happened, and kept going. At age 10, we were warming up to pitch a softball game in our local town here. And when she was actually on the softball mound, she twisted her left knee, and at that point could not walk, and could not walk off the actual field itself. And of course, myself being a mom and also being an athlete, thought this was a little bit ridiculous, but went, drug her off the field. We sat during the whole game. We actually returned home that afternoon, and she kept saying, my leg will not stop hurting. And we elevated the leg. We took some ibuprofen. I think we took some Tylenol. I'm not for sure which one. A few hours had passed, and we started noticing the leg actually started turning color. And it went from normal looking to a somewhat of a blue-white color, and she could not stand the thought of anyone getting near her leg, or the air, even the air blowing on the leg, anything. It was excruciating, and which I thought was a little bit over the top and ridiculous. But when I noticed the change of color, I thought there must be something wrong. So we ended up at Vanderbilt Children's Hospital, where they evaluated us. We went through several MRIs, an MRA, saw multiple doctors, and they couldn't find anything. And in fact, we were there so long, they actually made us leave the emergency room, go to the parking lot, come back and readmit ourselves because of insurance purposes. Because they didn't want us to leave, but they didn't want to not find something. They knew something was wrong. So after a series of several hours, I think I don't know how many hours we were actually there, but it was a lot. The vascular professor and a team of doctors came in, and they said, we believe your daughter has what is called RSD, CRPS. We had no idea what that consisted of, what it was, had never heard of it. We were told by the vascular professor there at Vanderbilt that there was a possibility they would have to amputate her leg. And basically what it boiled down to was, he said that there's been some sort of trauma, some sort of injury that has either not repaired itself or something has went seriously wrong, and that we were in for a very long, hard road, that if her leg did not wake up somehow, some way, she could possibly end up an amputee. So we were scared to death, and we were sent home. And we were told to follow up with our pediatrician. We followed up with our pediatrician the following day. Our pediatrician immediately called a local neurologist there at Centennial Hospital, and he waited on us to actually come. So we went up there that afternoon. We went through a series of tests. Our neurologist, who had never seen a child with RSD and said it did not exist, and sent us for a nuclear bone scan. And I think 2 days after the bone scan itself, our neurologist called us and said, it's confirmed, she does have RSD CRPS. And it's confirmed because some of the bone has even started deteriorating in 2 different places from the lack of blood flow, the lack of circulation. So he said he was going to consult with some others and figure out a way to treat what we're experiencing. He had no answers, no suggestions, and no idea as to where we were even going to start with treatment. I think the following day, maybe the one after, he called us and said, here's what we're going to start. We're going to start with Lyrica. We're going to start with lots and lots of prednisone, and we are going to see what happens. So, and physical therapy, if we can stand it. Because at that point, she could not stand anyone touching her leg, she couldn't go to school, she could barely sit in the bed. The sheet could not touch, could not shower, anything. It was 24/7, around the clock, excruciating pain. So for the next 4 years, we cycled through this same process of excruciating pain, and it was a roller coaster throughout the next 4 years with this. We went every year for a nuclear bone scan to see about the progression of the osteoporosis. It was ages from 10 to 14, and every time we would have a flare-up, a major flare-up, we would start over with the prednisone, the steroids, the Lyrica, the stomach medication, because I think we were taking 60 milligrams of prednisone a day. And so, and once we got better, we would taper off, and things would semi go back to normal. But we took 8 ibuprofen a day for about 3.5, 4 years. During this time, the neurologist recommended that we do not play sports. Also during this 4-year period, I was renting a building. I owned a business here, and this is actually what you see here. Dr. Glazer owns this building, and my flower shop was here. And one day he came in, and I asked him, like I had asked every other medical professional that I had met in the last 40 years, do you know anything about RSD? Do you know anyone who has it? Because we had yet to ever meet anyone that had it or knew how to treat it. We had never seen a doctor that had ever seen a child with it because it was very rare in children. And he said no, he did not. He was unaware. He knew a little bit about it, was very unaware of exactly what it all entailed. And that was pretty much it. He went on about his way, I went on about my way, and then weeks, months went by, and one day he calls me and says, "Where's your daughter?" And I said, "She's at school." And he said, "I would like to see her. I have someone here that I think could possibly offer her some help. And can you find her at school and bring her here to Soul Supports?" And I said, "Sure." So this is what we did. And now I'm going to turn it over to Dr. Glazer, who can tell you at this point.
Hi, I'm Dr. Ed Glazer, and I was renting this commercial property to Monica for a flower shop. And the reason that I came into this is I own a company that manufactures probably the most aggressive arch supports in the world. In fact, they're so high in the arch, they take a lot of time to get used to. They're difficult to get used to. And I've reinvented the field of foot biomechanics, and what I do for a living is travel around the world to places like Hawaii and, in Seattle. And I went to Seattle to lecture at the International Foot and Ankle Foundation meeting one year. And at the end of the lecture, I was approached by a young man named Gohl. Arik came up to me and said, "I came to this conference just to see you." I said, "Really? Who are you?" He said, "Arik Gohl, manual ligament therapist, strength and conditioning trainer, and licensed massage therapist." I said, no, I'm intrigued. What can I do for you? He said, I work for somebody who uses your technology, and we get people used to your orthotics in about a day and a half. I said, that's absolutely impossible. So I made him do the therapy on me. He actually came up to our hotel room, and he treated me and my wife with manual ligament therapy. And lo and behold, it worked. I took it back to Nashville. I took it on the road. I showed it to people. And people were getting used to their orthotics in a day and a half. I was so excited. I called Arik and I said, please, can I fly you to Nashville? I'm not going to get podiatrists to take your full course. What I'd rather do is fly you to Nashville, and you could film a 15, 20-minute explanation of just the points they need to get orthotics comfortable. So he agreed. And he came to Nashville, we filmed it, and at the end of the filming, by the way, we didn't go to this Nashville, we went to this Nashville, which is Lyles, Tennessee, where our company is. At the end of the filming, I remembered that Monica had said something about her daughter having RSD. And while I was watching him explain it, it occurred to me that possibly this therapy could work for RSD because it was creating such a profound relaxation in the muscles. It was visible, and it was so clear that it was erasing the history of that muscle's trauma. And I said, maybe this traumatically induced disorder could be helped with RSD. So I called Monica, and this was back in 2011 and around March. I called Monica and I said, hey, I need you to get Haley over here. So she actually went to her school and pulled her out of school in the middle of the school day and brought her right to this room, actually to this table that's right in front of me. And Arik began to press gently on ligaments. I told him, she has RSD, and he said, oh, okay, it might work. And I said, release her from here down, both legs. He started pressing on various parts and turning her foot and moving her knee and her hip and her rib cage. And I think the entire time he worked on her was less than 20 minutes. At the end of 20 minutes, Haley stood up and said, I have no pain. It was like a miracle. We looked at each other and said, well, there's this gating theory of pain. Maybe we shut the gate and the pain will be back tomorrow. So we told her, Haley and Monica, we'll be back tomorrow or the next day at the latest. Well, it was a while later, I ran into Monica and I said, how's Haley doing? She said, it was about a few weeks later, she said she's had no pain. It was maybe a month after that, I went by to collect the rent. How's Haley doing? No pain. I said, that's unusual. Let's watch it a little bit. Well, Monica then decided to take a really good job she was offered and started selling gifts in Mississippi. And she was commuting back and forth because her family stayed here. And one weekend, about a year after the original treatment, I ran into her in the local grocery store. I said, Monica, how's Haley doing? She said, still no pain. I said, I have to call Arik and tell him about this. This is beyond. So what happened? Not only did she get pain relief in her knee, but she also was getting pain in her back from tightening her muscles because of the pain in her knee and walking differently and functioning differently. And her back pain went away as well. I was absolutely floored. She was told in school never to play sports. Well, Haley didn't listen. In fact, instead of me telling you Haley's story, let me turn this back over to Monica DePriest to tell you about Haley's sports involvement.
So this is my daughter, Haley, who is now 20 years old. As Ed was saying earlier, the neurologist recommended that we never play sports, that we eliminate all sports activities from our everyday lifestyle because of the lateral movements in her leg could possibly re-injure the leg and cause more flare-ups, and even possibly to the point that there was no recovery at some point. Every time we would have a flare, we were always concerned that we may not have good results from the steroids and the pain meds and the nerve medication. So they said, don't take any chances, just quit playing altogether. My daughter's very athletic, and that was, the one single thing that she loved to do was to play sports. So she wasn't, that wasn't acceptable, and she refused. And so she said, if I'm going to end up an amputee, I'm going to do it. I'm going to go out with a bang. So we did not stop during our high school years. But we did, however, go on to run track, basketball, volleyball, all 4 years in school, and ended up her senior year being all district in basketball as well as all district in volleyball. So we're certainly glad at this point we did not stop our sports, and was voted most valuable player of the year her senior year. She also ran track, as you saw, and none of this would have been possible at any point during our 4 years of high school had it not been for the Gohl program and the manual ligament therapy. ARC truly, what I believe, and I firmly believe, saved us in so many ways. He saved us from the pain. He saved us from being a possible amputee. He helped us where no one else could ever help us. Until the day that we came here in this very room, on that very table, and it was just a simple visit. Had no idea what we were expecting, didn't know what to expect, didn't know anything about ARC. Came in here, got up on the table. I stood and talked to Ed to the side. ARC and his friend Stephen was with him, was doing different types of movements and stretching and measuring and pointing and touching for 20, 30 minutes possibly. All we know is when Haley got up off the table, she walked around and she kind of did a few movements and she said, "I'm not hurting." And Ed said, "Wow, that's amazing." Haley was amazed and just kept walking because she couldn't believe that she didn't have any pain anymore. And ARC stood there like, "Yep, I knew." It was just a strange situation. And so we basically said our thank yous, and I went back to work and I took Haley back to school. And she went on to college and on a full basketball scholarship to play at Ball State, and ended up having some of the best stats on the team her freshman year. And at this point, she had been 5 years with one MLT treatment, and she had been pain-free. This is one of her best games. She scored 19 points in this particular ball game, and was featured in the Tennessean. And we're just grateful. We're very grateful. And Dr. Glazer, Ed, calls me up a few months ago and says, "How's Haley?" And I said, "Haley's great. We're still doing great." I mean, I don't know how to explain it. We have no explanations other than we had one treatment. We got up off the table pain-free. We've been pain-free ever since. It's just a miracle, and we're forever grateful. And I don't think we would be here without ARC.
So, I'd like to introduce you to ARC Gohl and what happened after about a year of seeing Monica here and there and asking about Haley. I decided to call ARC and tell him about it. So I tried to find him through his email address, gone. His Facebook, gone. I Googled him, couldn't find him. In fact, Arik was completely and utterly missing. I thought maybe he died. I actually thought maybe he was abducted by aliens. But it turns out he wasn't abducted by aliens. Since I couldn't find him, I just forgot about it. Well, about 5 years later, I get a Facebook message from Arik. And he says, I've moved to Guadalajara, Mexico. So without further ado, I'd like to actually introduce you to the man that invented manual ligament therapy, really came up with the what we hope is a tremendous relief for many, many patients who suffer from chronic pain. I'd like to introduce you to Arik Gohl. Arik?
Hey everybody, so I'm Arik Gohl. I'm the guy who created manual ligament therapy. And like Dr. Glacier was saying, I ended up moving to Guadalajara, Mexico. I got married last year. No, it was this year. Yeah, just a couple months ago. Don't tell my wife I messed that up. But yeah, I ended up moving there about 3.5 years ago, and I moved my practice down there. And by the way, I'm a medical massage therapist or a manual therapist, and my training, as I had stated, covers a lot of things from strengthening and conditioning to neuromuscular therapies to postural re-education, all kinds of different things. And I'm going to tell you about how I invented manual ligament therapy, and also about a couple of experiences we've had with it recently in regards to CRPS and RSD, and also how it pertains to chronic pain syndromes in general. All right. So what happened back in 2004, I was working at a physical therapy clinic, and what I noticed, which became incredibly frustrating, is that it was taking a long time for patients to rehabilitate while receiving multiple modalities: physical therapy, occupational therapy, chiropractic adjustments, medical massage like I was giving them, injections, Vicodin, everything. And I noticed that I was taking patients 3, 4, 5, 6 months, even up to a year in some cases, to recover from things that I didn't really think should take that long. And I was very disgruntled to see these people having to go through this emotional roller coaster, up and down, one day good, one day bad. And it drove me nuts because I didn't think that there's any reason in the world people should suffer so much. So what I decided to do was find another way to approach injuries and pain. And what I did is I asked a good friend of mine, Dr. John Mishko, who's a chiropractor out in Tacoma, Washington, where I'm from. And I said, John, what do you guys as chiropractors do in regards to muscle spasm that helps you break that spasm? Chiropractors are kind of known for doing things fast and getting it done, all right? So I figured if anything, he would be able to give me a good shortcut. And he told me about the Logan Basic technique. And Logan Basic technique was developed by Dr. Logan in the early 1920s. This guy is one of the 2 founding fathers of modern chiropractic. And for some reason, Dr. Logan was really obsessed with the sacrum. Here's a picture of the Logan Basic being applied. And what happens is that gentle pressure is applied to the base of the sacrum, close to where it's approximated with the femur, with the hip, okay? And what ends up happening is that through this gentle pressure on what's called the sacrotuberous ligament, there's a strong relaxation effect that occurs in the spinal muscles up and down the vertebrae. And it's still used today. Okay, this is something that chiropractors use quite a bit. They learn it in school. They'll use it especially on scoliosis patients. And when Dr. Mishko had shown me this technique, I was completely blown away by how well it worked. And I was also at the same time very frustrated that, well, why aren't we taught this in school? Why aren't PTs taught this in school? Why aren't massage therapists taught this? It works so well. So the 2 biggest questions I had was, one, why does this work? Because ligaments are not supposed to have any kind of neurological component to them. They're just supposed to be dense connective tissue that holds together your joints, okay? He said, I don't know. He said Dr. Logan hypothesized that maybe it was because there was some smooth muscle cells from some connecting muscles that were in the ligament itself, and there was some kind of neurological loop that happened. And then I asked him, okay, well, what do other ligaments do? And he said, I don't know. Why don't you go figure that out? So that's what I started doing. So simple facts about ligaments, as I stated, they're really just known to be, throughout medical history, as dense connective tissue They hold your bones together, and they really don't have very good blood supply at all. Now, when you get beyond that into what we've learned over the last 30 years, ligaments are actually extremely neurologically sensitive, okay? What happens is that in a lot of cases, they're more sensitive than skin is when it comes to feeling stretch and pressure and even pain in a lot of cases. They found ligaments can be up to 6 times more sensitive than skin, okay? From here, what they do is they take this information about movement and stress, including inertia, gravity, emotional stress, you name it, and it takes that information, combines it with other information from your skin and from your muscles and tendons, and it sends it to the central nervous system. And from that point, your central nervous system figures out what muscles, what tissues need to contract and decontract, and basically keep you moving, keep you upright, all that good stuff. They also are very, very tuned in to the autonomic nervous system, and that really dictates our general feeling of being anxious, or the fight or flight sympathetic state, and also the parasympathetic or more relaxed state. Ligaments are directly connected into that. And here's what happens. Why do things go wrong with ligaments? Why are they so ingrained into the whole chronic pain and acute pain cycles? What occurs is actually a cycle of injury. And the first thing that happens is there's an injury. It could be a chronic injury or an acute injury. Okay. When the ligaments, they sense these injuries, when they sense this damage, they start sending signals to the nervous system to say, hey, there's something wrong. We need you to start tightening up different structures like connective tissues, or fascia, as it's called, and also muscles in the body. That's why when you sprain your ankle, you get a lot of inflammation and a lot of tightness around that ankle. That's your ligament saying, there's something wrong here. We need to tighten this up. So everything basically joins together to provide stability to that injured area. Now what happens, though, is unfortunately because ligaments have such poor blood supply, they don't heal like normal tissues. They will stay in a state of injury for months, years even, depending on the overall health of the person. Okay? While they're in this injured state, they continue to send information to the nervous system saying there's something wrong. Even while all the other tissues in that area have healed up, everything's good to go, the ligaments are still in this state of trauma. Now from that, what happens is basically a chronic kind of patterning of the body, where as the ligaments continue to tell the nervous system there's something wrong, even when there's not anymore, even when the injury is very old, the body has to start changing around this injury site. And that means the way you walk, the way you sit, everything. And I'll get into more of this as we talk about posture a little bit later in the presentation. All right, so because they keep thinking about injury, they perpetuate this sympathetic nervous system response, this fight or flight, this anxious feeling that we tend to feel when we're stressed out or injured, okay? They just continue to keep that going. They continue to keep the body twisting up and trying to support the damage in the body. And as I stated, we end up getting a lot of chronic pain just based on that. So when it comes to MLT, it's a very simple and gentle procedure we do. And really, because ligaments are so sensitive to movements and to pressure, and they're so instrumental in directing the nervous system, all we do really is we apply very gentle pressure to certain ligaments in the body. And throughout investigating manual ligament therapy while I was developing it, I found specific referral patterns of what ligaments influence what muscles. All right. So all we do really is to affect a certain muscle or part of the body, we position the limb accordingly. We put gentle pressure on the ligament, and what will happen is that the person receiving the therapy will fire another muscle, what we call an antagonistic or an oppositional force muscle, for just a few seconds, and what we get is essentially a reset in the system, a reset in the nervous system. For those of you who are actually watching the presentation here in the video version, here's a few pictures of it being done. You can see it looks almost like nothing. It looks like I'm just holding the arm or the leg in a certain position. I'm putting a little pressure here and there. It really doesn't look like anything, but the effects are extremely profound as to how it responds, or how the nervous system responds to it. The ligament pressure is only about 2 or 3 pounds per square inch. It's really almost like feeling nothing. And that's one of the reasons it works so well on people who suffer chronic pain syndromes such as RSD and CRPS. It does not require a lot of pressure. Okay, so the end result is really you get a very nice overall nervous system response where we bring the person into more of a parasympathetic or relaxed state, take them out of the freaked out, anxious state and drop them down a few notches. And when this occurs, the muscles and connective tissues throughout the body and also in the localized area that you treated with MLT, everything tends to get soft. Everything starts to get a normal length to it. And because of that, we get a nice reduction in especially pain symptoms. It's like hitting a big reset button in the nervous system. It's as if, for those of you guys who use Windows, on the computer, whenever you get that program not responding thing and you hit Control-Alt-Delete and it brings up that little window and you're able to reset that program, essentially this is like what we're doing. Okay, we're taking that little program that's been causing this bad loop of information to go through the nervous system. We're saying, reset. We don't need to be thinking that way anymore. Let's bring it back to where you should be. Let's bring it back to a base level, a relaxed state. So my side of the whole thing with when I first directly treated CRPS, RSD, when I first treated Haley, I had never even heard of this. And this condition is not very well known to a lot of the healthcare world just because it's considered a rare or a fringe type of disorder, and we're not educated much on it at all. And we're lucky if we even see it, or if we get a person who comes in who's diagnosed with it. So when Dr. Glaser said, hey, I got this girl that I know, and she has this disorder. Do you want to try out MLT on it? I said, sure, that sounds great. Let's do it. Let's give it a shot. So after doing the treatment on Haley, and I just kind of said, okay, if this works out, great. If not, then no big deal, because I didn't understand her symptoms. They hadn't told me how bad she was. So for me, it was just, let's see what happens. If not, no big deal. I decided, about 5 years later, to contact Dr. Glaser. And this is when I was in Mexico, and I sent him a text message on Facebook and said, hey, Ed, how's it going? What you up to? How's life? I'd love to come out to Nashville and spend some time with you and see what you're doing at the factory and with Soul Supports. And Ed said, hey, by the way, Haley DePriest, you remember her? Yeah. She's never had pain since. Really? Yeah, okay. Ed said, we should start doing some more experiments with MLT and CRPS because let's see if we can get more of these results. So Ed brought me back out at the end of April 2016, just a few months ago, to try some more MLT on CRPS patients. And he was able to conjure up about 11 patients who had CRPS. He went through a lot of resistance from the local neurologists and doctors when it came to recruiting these patients. None of them really wanted to cooperate. So Dr. Glaser ended up contacting one of the local CRPS RSD support groups here in Tennessee, and Omega Kumoto, who is the leader of that, she was able to spread the word, and we got some volunteers. So the demographics varied. Some of them were pretty young, in their mid-20s, some were over the age of 60s. Some of them had only had it a few years. A couple of them had had it over 18 years. They were all undergoing all the things that Haley had gone through, different injections and procedures and therapies, medications, a lot of medications. Pretty much all of them had multiple surgeries. And the pain levels, well, they were on the high end. A lot of them were up around the 7, 8, 9 level, but there was a couple that were down around the 4 level, with 0 being perfectly fine and 10 being the worst thing you could ever feel in your life. So we had some patients who were affected in their lower extremities, like their feet. We had one gentleman who hadn't been able to wash his feet in years just because the pain of bathing was so extreme. We had people who had their hands affected. We had 2 or 3 who had affected hands, something as simple as a dog bite in one case, something more complicated like a wrist fracture from a car accident in another case. So the conditions that we did the trials in weren't the best. We did it here in the Soul Supports factory, and we set up a treatment room, but it was pretty noisy. It was cold. There was a lot of air conditioning blowing. Air conditioning is not the best friend of CRPS patients. A lot of them had driven upwards of an hour to 3 hours just to come and see us. Actually, Dr. Glaser had sent Ubers out to pick them up, which was great. So they just sat back and, waited till they got here. And we wanted to focus on MLT as being the only modality that we applied. We didn't do anything else with them. It was just MLT. I spent about 20 minutes with a kind of a prepackaged protocol approach and just went to town, one after the other. and it spent about 20-25 minutes with each one. So before the treatments were administered, the patients would fill out all the required health release forms and also information on how long they'd had it, et cetera, but also a pain scale. So they would rate 0 to 10 how they were feeling that day before the treatment and again after the treatment. And the results, well, 4 of the patients, they reported no change or even a slight increase in their symptoms. 7 patients reported relief of about 50%. Okay, so we basically, in that 25-minute period of applying MLT, we cut their pain in half. Now, by the end of the second day of this 2-day adventure, 4 patients who had no relief, they pretty much stayed the same. The 3 of the 7 patients who reported that they had received relief actually experienced a decrease in pain that brought them down to almost 0. In fact, they couldn't even describe the pain. They said it wasn't like having pain anymore. It's just replaced by an odd sensation, okay? Something that they hadn't experienced in so long that if it was an absence of pain, they wouldn't know what to call it. Because at that point in their life, what is good feeling? What is a positive sensation, especially in the affected area? So all in all, here's what we found. 7 patients, including the ones who had almost complete resolution. On average, these 7 patients had a 70% reduction in pain and symptoms. We also had several patients with fibromyalgia who joined the study, and they also showed a pretty significant improvement in pain just within this first treatment. And we also had a few other people who came in with shoulder problems and extremities problems who were not diagnosed with CRPS. So let's talk about what happened with the not so good results. With the 4 patients who did not get the best results, what we did find was there were varying factors. A big part of that was the types of medications are on, the painkillers. Also, one patient had recently received a steroid injection from having been exposed to poison ivy. And that steroid injection had caused a flare before she even showed up for the trials. As we're going through treating more RSD and CRPS patients, we are noticing that there are some commonalities with folks who do not receive the best results, and we're going to keep investigating that to figure out exactly what the cause is. But the good results, what happened? Well, because RSD is this hyper response to the autonomic nervous system, where it's this sympathetic vice that grips the body. And the fact that MLT has shown hypothetically to have a very strong decreasing effect on that sympathetic nervous system response, what we think is happening is that MLT is directly putting a reset or a stop to this sympathetic response caused by RSD and CRPS. So when we were finished with the trials, I told Dr. Glaser, I said, I'm only getting 20 minutes with these people. I'm only doing MLT. I think we can do a lot better. MLT is just a tip of the iceberg of what I do in my private practice. I do a lot of other things. And if we can get this result with just this modality, imagine if we put the other things I do together. And we'll talk about those things here. I do a lot of things with dynamic stretching. It's one of my fortes. I love dynamic stretching. There's also a lot of movement therapies. I do a lot of re-education on posture, on walking, on breathing, all sorts of different things that people take for granted or don't even think about that directly impact their day-to-day pain. Also, I thought, hey, a lot of the patients who suffer these conditions have allergies. A lot of them have pre-existing allergies to food, to medication, you name it. They're not eating healthy. They have high blood pressure. They have diabetes. What if we introduce some nutritional coaching into this? The other important thing is counseling. When you're suffering with this kind of pain for this long, the negative feelings, the thoughts that envelop your life every day, every second, it's got to, in its own way, create even more stress in the body. That creates even more contraction in the body. That creates more anxiety. It just feeds into the whole cycle. So we have to hit this from different angles. When you do this, it creates space in the body. Okay? When you stretch the body, when you teach it how to move again, when you teach it how to breathe properly, when you talk to the person, when you tell them, look, there is light at the end of the tunnel. There is a way to get out of this. It's multifaceted. It's not just getting injections and implants and believing everything you're told about this incurable disease. This emotional release, this physical release causes space in the body, and that's what helps us heal. It gives us circulation of blood. The lymphatic fluids start to flow again. Nervous signals start to shoot around the body like they're supposed to. That crimping effect of pain starts to open up, and it gives us a space for healing. So let's talk about chronic pain in general with the musculoskeletal system, okay? We are really overloaded on pain. The whole nation, the whole world, especially here in the U.S. 100 million of us, that's a third of us suffer from chronic pain, all right? There's millions of people who are treated with meds and with surgery, and really there's not a whole lot of positive effects that comes out of that. We lose billions and billions. In fact, up to $635 billion are lost each year in this segment of society that can no longer produce and contribute to the country, to their own lives, et cetera. They can't work. They're using a lot of the medical resources, a lot of the things that really should not have to be dedicated to these folks, because there is an answer. There is a way to get out of this pain. It does not require them to sit in a chair all day suffering and to taking meds and really just shutting down in life. And really, let's get down to what causes a lot of this. And it's something we don't even think about. It's something that's around us constantly, but most of us, because it's invisible, don't even stop to consider it, and that's gravity. Gravity is the strongest force in the universe, all right? I'm not a physics major or anything like that, but obviously, from my experience over the last 20 years working with patients, I can see what it does to people on a daily basis, and it is a key factor in why pain exists in the body. And the reality of posture. Let's talk about posture. Okay, we're going to talk about posture and how gravity affects it, and how gravity and posture affect what happens on the inside of our bodies, how it affects pain, how it increases pain, how it can decrease pain if it's dealt with properly within the body. What happens is that since we're babies, from the time we start to manipulate objects in front of us, our posture starts to change. Okay, we see something in front of us, our eyes go towards it, our body goes towards it, and next thing you know, through the rest of our lives, everything is done in front of us. Our heads go down, our heads go forward, our body follows it. Our whole life is spent in front of us, okay? Driving, cooking, computer work, the root of all evil, all those things contribute to bad posture. Now, what happens with posture is, in gravity in specific, is that once your head gets a certain point in front of your body, the weight of your head doubles, triples, even quadruples, as in regards to how your body feels the weight of your head. For every inch that your head is forward of a good position, which is really directly over your shoulders, and if you draw a line straight down to the body, the weight of the head, the torso, the hips, everything should be balanced in your heels. All right? Now, if your head goes forward, your body tends to follow. Next thing you know, that 10-pound head turns into a 20-pound bowling ball. By the time your head is looking straight down at a cell phone or a tablet or something like that, the equivalent weight's about 80 pounds. All right, so imagine what that's doing to every tissue in your body, especially the ones on your back, the ones that are trying to hold you up and keep from falling on your face. That's why so many people have problems in their backs. It's not because there's anything wrong with their back, it's because every tissue is straining to keep us from falling flat on our noses. But that's what happens typically, is people focus on the pain in their back, the therapists or the doctors focus on the pain in the back, and that's where they go for treatment. But there's nothing wrong with the back, all right? It's all in how your body is dealing with gravity and the immense strain that is suffering just holding your head up. What ends up happening, as your head goes forward and starts getting projected in front of you, the natural response is that your lower back arches, and that pushes your hips forward, because when your back arches, your lower back arches, it brings your eyes back up. But that's just a simple response from your body. That's not the correct response. So as the back arches, pushes the hips forward, the knees go straight, the weight ends up in the toes. The weight jams right into the toes, and Dr. Glaser can tell you all the nice stuff that happens when your weight goes in your toes. All kinds of plantar fascial pain, Morton's neuroma, you name it. These are all posture and gravity related. And it all starts with your head, guys. When you add into that the whole idea of stress, which we go through all day long with work, with families, with responsibilities, these things, what they naturally do is they cause this fight or flight reaction in the body. Something's, I'm really ticked off, something's stressing me out today. And guess what that does? That causes the large muscles in the front of your body, like your abdominal muscles, your pectoral muscles, your leg muscles. Everything contracts to protect your organs. All right? So you basically go into what I call armadillo mode. Your body is trying to fold into a ball. All right? Everything's tucking forward. Now, if you combine that with what gravity is doing to you, every tissue in your body starts to constrict. You take away the space. You take away the space for blood flow, lymphatic flow, digestive juices, for nervous system signals. Everything gets crunched, just like putting a crimp on a hose. And what happens after that? Well, nothing moves. Okay? And the less you move, the more pain you got. Because the less you move, the less circulation there is, and you're already stressed for circulation as it is. So the worse your pain gets, the worse you feel. You start to get other symptoms in your body, digestive system, the clearness of the mind, pain in your knees, pain in your feet. You got it. It's all there. Healing becomes very difficult because of this. When things don't move, the tissues don't get the circulation of nutrition that they require. Your brain doesn't get the nutrition it requires. Your spinal column doesn't get the nutrition it requires. So what we do for that commonly is we take a lot of drugs. We are an overprescribed nation. All right, we have billions and billions of dollars that the pharmaceutical companies get to make giving us drugs, and they normally just cover up symptoms. They cause things like dependence. They cause side effects that actually make us worse, make us feel worse. A lot of patients with chronic pain will say, at this point, I don't know what makes me feel worse, the pain syndrome or the drugs that I take. You tell me. Surgery. Surgery is focused on the place that hurts. That place that actually hurts is very rarely where the problem is. The problem is in another place of the body, all related to posture and gravity and how you've been using your body over the years. Surgery is most of the time unsuccessful. I've read in different journals and studies that about 85% of the time, for instance, low back surgery does not have success. But it's sold constantly to patients as being the cure-all for herniated discs and nerve impingement and all this stuff. Typically, people have to go back for repeat visits of surgery. And this is one thing I noticed with people with CRPS is that they had more than one surgery. And usually after the second or third time is when their symptoms really started to kick up on them. Conventional physical therapy, I know a lot of really good PTs and OTs, and I'm not talking bad at all about them. Okay. What happens, though, is there's an over-reliance in physical therapy on modalities such as electrical stim and ultrasound, iontophoresis, these different types of things that, again, focus on where the pain is. All right? They also give a lot of exercises that don't treat the body as a whole. They just treat, oh, the knee hurts. Let's do a lot of extension with TheraBands with the knee. Let's do a lot of hip extension, hip flexion movements, all right? But they don't treat the whole body. They just look at where it's hurting. And part of that is based on how the insurance system works. The insurance system does not, reimburse very well if a PT says, I'm treating another place that doesn't hurt the body. Okay. It requires a lot of visits. A lot of conditions require 20 to 40 visits of physical therapy, and this can be a daily occurrence for people. And it's expensive. If you don't have insurance, or if you have an insurance with a high deductible, PT is extremely expensive, and it can go on for a very long time. So what we do that's so different is we focus on the source of the problem, which is not where the pain is. It's on what the whole body's doing. We have to look at the way the body responds to stress. What elements are in the person's life that causes stress? We have to look at their diet. We have to look at how they're spending their time. Are they sitting a lot? Are they not stretching correctly? Are they spending a lot of time standing in the same position? We have to find out what contributes to the discomfort they have. And when it comes to things like CRPS and RSD, we have to look at how is their day, how is their life, how is their week, month, whatever, how has it been wrapped around this disorder? Because chronic pain, any kind of pain in general, there's a huge psychological factor into it. It's not just physical. As a therapist, I think that 85% of what we do, 90% is psychology. And in treating people with chronic pain and CRPS, time and time again, that is a huge part of getting them to see the light beyond the dark that they experience with having chronic pain disorders. What we do is not rocket science, okay? It's not something that took 30 years of development in a university somewhere at MIT. what we do is we use manual ligament therapy to calm down the nervous system. This enables us to really have, from a base foundation, start to build on to the body. Okay, from there we can do things like start to mobilize the large muscles in the body, the abs, the chest, all these muscles that are constricted to produce that armadillo posture that we have. Get those to open up, get air flowing, get blood flowing again. And from there we have to re-educate the patient on how to move, how to stand, how to hold their weight in their body, putting their weight in their heels, which the orthotics are great for. So with all our patients, we put them in orthotics right off the bat from the first day. We get them casted and fit in for orthotics because they need all the help they can get to start taking that weight from their toes and way out in front of them to putting it back where it should be. Right? And also the education of being aware of how your body is moving and what it's doing. You can't just go through life just picking up your arm to grab things and walking around and running if you don't know really how you're supposed to move, and that what you're doing could be causing more problems. And what we find is probably the biggest tool is the education part of it. A lot of people talk about going to see a specialist or seeing a therapist and really just being told, okay, we don't know what's happening, but here, take this, go do this procedure, X, Y, Z. And I can't tell you how many times I've had a patient tell me, I don't feel like I understand what's going on with myself. And it's because they've never been told for whatever reason. Maybe because the person they've been seeing or the specialists that they have been seeing don't know, or maybe they're just not taking the time to explain to the person all the different things that impact them. So we talk to the people in the Gohl program, and we talk to them about what happens with different disorders and how the body reacts to it, just like we did in this webinar, just like we did in this presentation. What causes the body to contract? Get them knowing their body on a level they've never understood before. And that's completely empowering because it gives them that idea of, okay, now I know how my body works and what it does on a very basic level that's not full of mumbo jumbo and scientific words, and I'm given the tools of how to start dealing with myself and dealing with the things that I experience. And that is worth its weight in gold. And as we're going through treating these patients, we hear this time and time again. Thank you for letting us, telling me how I can take care of myself, empowering me with things, not just keeping me in the dark and shoving more treatments at me. So it's your body. You got to learn how to use it correctly. And it's something that we forgot to do a long time ago. And it's probably the most important thing. All right. So you do need a vacation from pain. Get in touch with us. We have a program for you that really does work. It really does help. You can see the testimonials. It's real. It's not just another shot in the dark that someone's promising results with. This is the real deal. It's education. It's treatment. It's a life-changing experience. And please give us a call, contact us, share your story with us. For information, you can go to gohlprogram.com. That's Gohl program.com. You can also find a station on YouTube, Gohl Program TV, and you can see the testimonials right there. And also testimonials from Haley herself, from CRPS patients from the first pilot study we did, and all the newest up-to-date patients that we're treating just right now, actually. So there's a lot of information on the website that reiterates what I talked about today. And I think it'll really give you a better idea of what we're up to and how we're doing things. And I hope that it makes you consider joining us. All right? Thanks, everybody.